Hi guys, this is Justin, your biology laboratory technician here at P&W Westville, and I'm in your anatomy and physiology lab, and I'm going to do a video demo on how to dissect a fetal pig. I'm just going to go through all the steps that you would go through if you were here in lab and doing the dissection yourself. So when you're shown this video, you can kind of have a better idea on how to learn some of the pig anatomy and how it may relate to human anatomy, which a lot of it does. So first of all, we're going to go through an external inspection of our fetal pig and just note a few of the obvious things that we can see just before even dissecting it. So I first want to start with the head here, so I'm going to zoom in a little bit so we can get a better look. Okay, so in our head we can see some obvious things like the eyes, the nose, the mouth, the tongue, and the ears, or these ear flaps called auricles, which help protect a lot of the internal hearing anatomy structures, or the external pinnae, which is just housing all of the vital hearing things like the eardrum and etc. And then we want to look at a little closer at the eye here. If we pry open the eyelids, which I'll do with a little help from a probe, we can see what's called a nictitating membrane, or it's just a thin layer of tissue that overlies the eyeball. You can see the cloudiness a little bit there. That's the nictitating membrane, which helps keep the, let's see, there you can see a little color difference between this side of the eye, and then you can see this thicker tissue on the anterior, towards the anterior corner of the eye here, and that's the membrane that helps kind of wipe away debris and help keep the eyeball clean. Okay, so from there we can also look at our fetal pig and determine the sex of the pig by looking at some of the urogenital anatomical features that it has. So if we flip the pig to ventral side up here, we can see the umbilicus here. And in males, you would see a little opening on the undersurface of the umbilicus, and that would be a urogenital feature, and this does not have that opening, so that's a good indicator already that we're looking at a female. And if we go more towards the tail posteriorly, we can see the base of the tail is the anus, and then just anterior to that is another urogenital anatomical feature and another hole here. So we can determine that the sex of this specimen is in fact a female. In a male, which I'll show you in a later video, this would not be present, and there would be a lump here protruding just above the anus, and that would be where the testicles lie. And then also the internal anatomy, we can look a little closer when we get into the reproductive structures on how to tell the difference between a male and a female. So we know this is a female, and another thing we want to do is to determine an approximate age by measuring it with a meter stick. So if I just take a meter stick and go from the base of the tail to the tip of the rostrum or the nose there, I can get an approximate measurement of 33 centimeters. So if we convert that to millimeters, we can get an approximate gestational age of our fetal pig. Okay, so I was just using this specimen here to show you some of the external anatomy, and I actually already have the one we're actually going to dissect, which is very similar to this one. And I have it all ready to go. So I'm just going to switch this out really quick. Now I have all my surgical instruments that I'm going to be using for the dissection ready to go on either side here. You don't need that anymore. So I have some curved forceps, blunt cutting scissors, rat tooth forceps, blunt and sharp probes, some hemostats, sharp scissors, and a brand new scalpel with or rather a brand new blade on a scalpel, number 10 size blade there. Okay. Okay, so first we want to perform the incision that's going to open our thoracic and abdominal cavities here. So I'm going to walk through on how to do that. I'll zoom in a little bit. Okay, so you'll notice this incision that's already made here. These fetal pigs came like this because this is what they use as an access point to inject different colors into the vascular system. So these are double injected specimens that have both a red and a blue latex dye that fills the vasculature. And anything blue we see on the internal anatomy is going to be some kind of vein. And then anything red we see is going to be some kind of artery. So that kind of helps us just visualize with colors on where we're at and what we're looking at. So that's why that incision's already there. So what I'm going to do is just continue this incision along the superior portion of the thoracic cavity here, and then we'll make a midline incision down to the border of the diaphragm, and then continue down the abdomen there, and then go laterally around the umbilicus, and then continue all the way down to the tail. So scalpels are obviously very sharp, so we want to be careful not to go too deep and damage any structures that we want to see. We want to preserve all those underlying structures, so it's okay to make a shallow or superficial cut at first, and then we'll go back with blunt scissors to continue the cut. And the blunt scissors really help protect anything that we want to look at. Okay, so first of all, I'm just going to come across and continue that incision there, just so contralaterally they're about the same. I'm going to find the midline of the ventral surface here, and I'm just going to cut all the way down the midline until we get to about right above the diaphragm. Okay. Spread it apart to see where you're at. Alright. And then just keep palpating, and you can feel the ribs and the bottom of the rib cage. And we know that at the bottom or the inferior portion of the rib cage is where our diaphragm will begin. So I'm just going to continue a little more there. And then I'm going to make lateral cuts on both sides. that. Okay, now I'm gonna continue down into the abdomen region. I'm gonna try to avoid this whole umbilicus area. So I'm just gonna go lateral again, go around the teats, or the little mammary structures that you see there. You can't see them. They're pretty small. And I'm just gonna go around like this. And continue all the way down around the base of the tail. Do the same thing on the other side. Okay. So now I'll just make sure all my cuts are through the skin. I can clearly see where I traced that superficial cut. Good, looking all right. So now I'm going to take my blunt scissors, so you can see how one end here has a curve on it, not a sharp point like that. So I'm going to use that towards the specimen so I don't damage anything under there. I'm just going to make my cut. Up a little bit. So the ribs in our fetal pig haven't been fully ossified yet, so they're really cartilaginous, so they're actually fairly easy to just cut through with scissors. So that's what I'm going to work on here, trying to do. Starting cut there with the sharp scissors, and then continue with the blunt. That's probably easier. There we go. I'll just be switching in and out of different instruments just to get these cuts going. scissors again. Getting there. Scalpel again. Look for my cut I made previously. Just try to keep this tight by pulling up on the umbilicus there. Okay, so now I can get my probe under here. Just try to free up our skin from all the connective tissue and fascia that's lying deep to it. I'm going to try to preserve our umbilical vein, which will be one of the first vascular structures that we see. Muscle there. Just cut that free. Some more connective tissue. Okay, good. So now I can zoom in a little bit. Just okay, so we can see this umbilical vein right here. Okay. Now we also want to look for the diaphragm, so let me free this up on this side a little. There it is. So you can see the diaphragm that lies just superior to the liver. And the liver is this really big organ you see right here with the umbilical vein running right there. Okay, so I'm just gonna free up this area and just clean it up so we can start getting into the thoracic area. Okay, so now you can really see the diaphragm right there. It's just like one long muscle looking structure, but it's very thin. So I'm just going to free that up from the connective tissue here just by pulling on it. Okay, good. So now you can see the separation of the thoracic cavity up here and the abdominal cavity here via the diaphragm. All right. Now I'm just going to continue in the abdominal region actually right now, just so you can we can look for the urinary bladder. So I'm just going to keep this tight and continue along my initial cut. Now that we've seen the umbilical vein, we can go ahead and disconnect that. All right, so now we can really see our digestive system starting to come into the view here. Okay. And that's just a bunch of the preservative that these pigs were preserved in. So, okay. All right, so now we can really see the diaphragm here that I'm holding. Inferior to that would be the liver. We have the spleen down here. We have the stomach right here. And under that, we should be able to see the pancreas. We'll actually go back and look for that. So for right now, though, I'm going to continue just in the thoracic cavity, so we can start looking at some of the main arterial and venual supplies and drainage for the heart and the lungs. Okay. So I'm just going to cut up the middle with my blunt scissors and really expose this. Muscle there and connective tissue. Okay. Okay, so now we can see the heart, and specifically this the pericardial sac. You can see is this thin little layer right here surrounding the heart. And we can start to see the lungs on each side. We lift up the sac. We can start to see the thymus. So that's these little flap-looking structures on the superior side of the heart, looking at the right and left atria there. We can see the coronary artery going across here. You can kind of use that to separate the left and right ventricles of the heart. Over here you can see some lobes of the right lung, lobes of the left lung. And now we're just going to go a little deeper and start and try to find things like the superior vena cava and some of the branches that come from that. Alright. I'm just going to make sure all these vital structures are out of the way and just clean this up a little more. Okay. Okay, so now we can see the pulmonary trunk. So that's this right here. You can tell it's a little slightly different colored. Here, let me try to zoom in. Okay. So just to gauge where you're at, here's the heart. Head is this way, tail is that way. So superior, inferior. And we can see the pulmonary trunk right here. Now if we go up a little bit, we can see this blue-ish color coming through. I'm going to try to get some of this tissue out of the way so you can see the color a little better. Okay, so that would be the superior vena cava, which, if we look on the other side of the heart here, you can see that it goes down, and just below this bottom portion of this lung here, and just above the diaphragm, we can see the inferior vena cava right there. So I'm going to put my forceps right under the inferior vena cava right there. Alright, so I'm just cleaning some of this out so we can get a better look at some of the arterial structures. I'm actually going to make a more superior incision so I can open up the window up here by the trachea. Okay, so we can see in the cervical region here, the anterior side of the larynx, way up here, and we can see a gland up in here as well. And a lot of muscles. Gland up here. Let's see. Glandular looking structure up there. Okay. Okay, so now I want to start looking for some deeper arteries. So if we go back to our superior part of the heart, our pulmonary trunk there, the ductus arteriosus here. Let me clean up again. Okay. Now we can see our aortic arch, which gives rise to the brachiocephalic trunk here. So here's our aortic arch, brachiocephalic trunk, and then that gives rise to the right subclavian artery right here, and it goes laterally to serve the brachium and the within the brachial plexus. Over here is another branch coming off of the brachiocephalic trunk, giving rise to the left subclavian artery right there. Let me try to zoom in on this for you guys. I know it's hard to see. Okay. I'll try to clean it up for you too. There we go, it's a little better. Okay, so once again, pulmonary trunk, ductus arteriosus, our aortic arch, giving rise to the left subclavian artery, brachiocephalic trunk here, giving rise to the right subclavian artery. And then you can see these branches. Here, let me clean this up. So here we can start to see the left carotid artery right there, and then this other branch going to the right carotid. Okay, and now you can really start to see the trachea right here. Okay, so now we want to look at the very deep part of our main artery in our body. So that which gives rise to the aortic arch. We have our aorta, which we can view if we pull the heart to the side, get our fingers under the lungs, the left lungs here, and pull so we can look very deep behind all this. It's going to be really hard to see. I'm just going to clean this up. Okay, so we look at this right here. That's our aorta. And it's literally running right in front of the spine there. An abdominal aorta would just be the portion that serves the abdominal area and the lower extremities, or doesn't directly serve the lower extremities, but it mainly the abdominal arterial supply, which down in the legs would be the branch into the lower extremities. But here you can really see the aorta here. Okay. So what we're going to do is stop here, and then we'll see if what we're going to probably pick up next week is more into the respiratory system here. So I will be cleaning away some of this, and we'll readdress some of the structures that we saw today after I get it cleaned up a little more. I just wanted to show you guys sometimes how difficult it is to do a really clean dissection and identify all these things. But if you know, the more you practice anything, the better you get. So hopefully I'll get a little bit better for you too. But yeah, we can see some of the main structures that we've uncovered today. And after that, we'll get into the digestive system, the reproductive system, and the urinary system. And we'll really be able to hit on a lot of the main structures that you guys are studying. So we will see you guys next week with another video. Thank you.